Hello, I'm Diane Brenneman. I'm a family member with lived experience, and I'm the training director at Child Health Specialty Clinics at the University of Iowa.
Hello, I'm Alejandra Scoto, the Title V Program Coordinator at Child Health Specialty Clinics at the University of Iowa.
You know, we're committed to offering family training to all communities, regardless of the language spoken. So this past year, we jumped right into offering our trainings in Spanish, and we learned some things along the way. So in this session, we'd like to share with you the lessons learned from these experiences.
Today we'll be discussing the pros and cons of various modes of interpretation that we used in two of our most recent programming efforts. We will also be diving into the collaboration strategies that were used to determine the needs of Spanish-speaking families participating in our trainings. Lastly, we'll be discussing what worked, what didn't work, and the strategies for the involvement of non-English speaking families in our trainings. I also wanted to take a moment to thank all of our partners in these efforts, including the Iowa DD Council, the University of Iowa Center for Disabilities and Development and Stead Family Children's Hospital, the Iowa Regional Autism Assistance Program, and the Child Health Specialty Clinics, along with the IFLTI core team, Rachel Charlot and Jody Ballard.
Child Health Specialty Clinics is part of the University of Iowa's Pediatric Division of Child and Community Health. Our division administers Iowa's Maternal and Child Health Title V program for children and youth with special health care needs. We do this through a network of 13 regional centers and satellite locations in underserved areas across Iowa. We employ about 100 public health providers, including family members hired as peer support specialists or family navigators.
We are one of the few Title V agencies in the country that is housed within a university system. In addition to providing clinical services, family-to-family support, and resources, we also offer family leadership training. Health equity is embedded in our division strategic plan and Title V block grant, and therefore we are committed to moving forward in providing culturally appropriate and culturally relevant trainings to all communities.
We believe in the capacity of families to be agents of change and that families are necessary for the ongoing sustainability of systems level progress.
So we're going to start off by talking about our Transition to Adulthood webinar series. In the fall of 2020, our traditionally in-person annual caregiver retreat for caregivers of transitioning youth was adapted into a 6-week webinar series. Our sponsors and collaborators for this event included the Iowa DD Council, the Regional Autism Assistance Program, and the USAID. In this series, we invited content experts on transition to share resources in an hour-long recorded presentation of families that happened on a weekly basis. On the left-hand side of the screen is a screenshot of what the webinar would have looked like for participants, and on the right is a promotional material for the webinar series. Marketing for this webinar series was provided in both English and Spanish. As we were developing this webinar series, one of our trainees from a different program, which is LEND, identified the need for her Spanish-speaking community to learn about the topics that we were offering through this webinar series. Due to this identified need, we developed a plan to provide simultaneous interpretation to Spanish-speaking families. The families were able to use a device, either a computer, a tablet, sometimes a cell phone, to join the webinar and then call into a conference line where live interpretation was being offered. After the webinar series, we wanted to offer recordings with Spanish subtitles, so we worked with an interpreter that was within the university to get those to our Spanish-speaking families. As I mentioned before, we were able to set up simultaneous interpretation for our live webinars after our community leader identified the need. We quickly learned that technology was a barrier for many of the families we were working with. There was not only a lack of familiarity with the webinar platform that we were using, but there were also often issues with accessing the appropriate technology for both viewing the webinar and calling into the conference line. Many of our families also had broadband issues, so a solution to this was that they met up with each other in advance and then viewed and called into the webinar just using that one device. Due to the technological barriers, we also developed a cheat sheet for our participants in Spanish that illustrated how to use the technology, and we hosted several calls with Spanish-speaking participants to explain how to access the platform and answer any questions that they might have had. As program staff, we also figured out a system to help with on-the-fly troubleshooting. We each had a Post-it note by our computers with each of the participants' phone numbers, and they were able to text or call us during the presentation if they had any issues. This seemed to work really well as it allowed us to give more personal assistance, as well as get to better know the participants and their specific needs. In a pre-COVID world, we as program staff would have probably been able to be a bit more accommodating in terms of increasing the access to technology and streamlining the system, but this webinar series was taking place at the height of COVID and in-person meetings were difficult to arrange. For our post-webinar production, we downloaded the auto-generated transcript from our webinar recording and sent it to our interpreter to translate the transcripts. We then worked on adding the translated transcripts as subtitles to the webinar recordings and plan on uploading them to our YouTube channel. We chose to put in the subtitles instead of adding translated subtitles on top of a translated voiceover for a variety of reasons, but cost is a big factor in this decision. Speaking of cost, since Child Health Specialty Clinics is part of the University of Iowa healthcare system, we have access to free interpretation services. We understand that we are in a unique position to have these kind of resources, but I wanted to share what it would have cost if we had to hire out our interpretation services. The regular rates for live interpretation using our external contacts runs us about $60 per hour for weekdays and $70 per hour on weekends. The estimated cost for what we provided for this webinar series is $420. We also contracted our interpreter from the hospital system to translate our transcripts. Since this was above and beyond his regular job duties, we worked out a contract to compensate him for his extra time on the project. This would end up being around $2,100 for his contract. And now I'll move on to Diane so she can talk a little bit about Iowa Family Leadership Training Institute.
Thanks, Alejandra. The Iowa Family Leadership Training Institute, or IFLTI as we call it, provides trainings to Iowa's parents and primary caregivers of children and youth with special health care needs to develop their leadership skills and become better advocates. We meet with cohorts of about 12 family leaders over 4 months with 2-day sessions. This training works to increase their confidence and capacity through self-reflection and skills building, training to work with partners, discovery of their own path to leadership, and the development of their advocacy strategies. Now in its 6th year, we discovered 1/3 of the participants in the 2021 cohort were Spanish speaking. The same trainee that helped with the webinar series believed IFLTI would be good for her community. So we translated our promotional flyer and application into Spanish. The Latina leader recruited among her community. The course assignments are managed on Google Classroom, and those assignments were translated and a cheat sheet provided on how to make your browser read in Spanish. I met with Spanish-speaking participants in person prior to the training to introduce Google Classroom and to brainstorm with them the best way to hand in assignments should Classroom not work for them. If we had plenty of lead time, our hospital's interpretation office translated handouts, but for last-minute needs, we contracted with an outside translation service. We secured on-site interpretation services from that outside vendor. And by the second session, we purchased wireless audio transmission equipment. The training provides one-on-one mentors, and we couldn't find Spanish-speaking mentors. So we used a video interpretation platform from our vendor to facilitate mentoring sessions between those meetings. In addition, we discovered that PowerPoint offers a live Spanish captioning service for using slides. To translate interpersonal communication, we used Google Translate. We had heard it's not the most reliable translation, but we did check it with our Spanish speakers and they said it was okay. In addition, we chose videos to illustrate our presentations that had the capacity to auto-translate into Spanish subtitles. Because poor broadband access made the video interpretation spotty, we arranged for in-person mentoring for Spanish speakers. After the first session, we asked the Spanish speakers how the interpretation worked using the bilingual community leader. They said they couldn't hear the soft voices of the interpreter, especially through her mask, but didn't want to interpret the other student. They didn't want to interrupt the other students by asking her to speak more loudly. So we purchased equipment so the listeners could wear headsets that connect wirelessly to a transmitter the interpreter uses. This worked well when we remembered to charge the equipment between sessions. Our contracted interpreters use Boost Lingo, a video platform where the mentor, mentee, and interpreter could meet virtually. The mentors could also schedule recurring appointments on their own, and I used it during sessions when we had need for an extra interpreter for small group work. Like all technology, precious time was lost getting used to the platform. And again, poor broadband access of the participants made this video difficult, and they often reverted to audio, but this meant we were paying for more service than we were using. Despite the tech, mentors couldn't get a good look at mentees' facial expressions and tone. So as I said, we invited mentors of those Spanish speakers to attend session 3 to meet in person, and this was much more effective than video interpretation. Another thing that we learned is that both English and Spanish presenters had to learn to slow down and use pauses to allow the interpreter a chance to translate. More than once, the interpreter stood up and motioned for the presenter to slow down. Toward the middle of the training, we discovered that PowerPoint has a subtitle feature that captures the speaker's words. You can set the subtitles to translate many different languages. But we noticed that participants needed to see the slide as well as watch the subtitles below. So we know that this was not a substitute for having that in-person interpreter. Typically, we don't print slides in training. It doesn't lend itself to interactive learning and kills trees. But for some of our denser material, we did translate and print some of the slides in session 3. And both the participants and the interpreter appreciated it. We also started to send slides ahead of time to the interpreters to assist them in preparation for unusual concepts and words. And finally, extra translators were hired when participants needed to interview their partners or host English speakers as part of their community service projects. We wondered how to encourage engagement across the language barrier. Spanish speakers needed to be close to each other in the first session to hear the interpreter. And after we added wireless devices that would have permitted them to sit anywhere and hear, their seating arrangements were kind of set. 3 other participants were also bilingual as it happened, and that aided greatly to pair work. We provided lunch and dinner for our interpreters as the sessions spanned before and after meals. And Spanish speakers naturally chose to eat together with their interpreter. But on that plus side, those bilingual participants sometimes joined the Spanish speaking table. And I was pleased to see that the Spanish speakers grew comfortable in the cohort. And by the second session, they began to contribute to class discussion using the interpreter. And in one session, a tres leches cake was even brought to share. And the costs. We invested nearly $10,000 in making this family training accessible to Spanish-speaking family leaders. The in-person interpreters for the sessions and the video interpreters for the mentor pairs were about $4,500. And translating the documents into Spanish was about $5,000 on the books, but the in-house translation saved us about $1,700. The wireless headsets cost $200, although you can spend a lot more. Although considerable, we see this as an investment. Now the documents are translated. So next year we need only budget for the live interpretation. And if we can develop relationships and secure Spanish-speaking mentors, next year's budget will be closer to $3,500.
So we learned a lot from this process, and we wanted to share some of our recommendations and advice. Our first recommendation or piece of advice is that offering translation does not equal offering culturally appropriate training. It is best practice to involve a cultural broker in the planning stages because you are not the expert in another's culture. The cultural broker we found is invaluable for marketing. They can give insight on methods for distributing information based on cultural or community norms. And do you have a little story, Diane, that you want to share?
Yeah, we translated the flyer into Spanish, and I said to our community contact, here's the Spanish version of our flyer. And she said, yeah, Diane, we don't really email flyers to each other to learn about training. I'll tell them about it. The other thing we noticed is that cohorts of the shared language speakers was much more attractive than being invited to be the only one that uses translation. And the technology. We need to assess barriers. For example, our community was familiar with Zoom, but not very familiar with the platform we used. The community didn't traditionally use email, so it was difficult to share links and go through the several steps to get on GoToWebinar. It's important to think outside the box when it comes to involving participants and not expect our automated registration systems to work with all communities. As Alejandra mentioned, we personally called participants to make sure they were set up, and we met with them in person to help them with barriers.
Another thing we found is that it's really important to allocate staff time appropriately. If you're going to do a webinar, you need a staff person in the background to help troubleshoot technology. And we found that teams work so much better than one solo person trying to juggle too many balls in the air. For a project like this. There's a lot of moving parts. There's the technology, there's working with the participants, working with the non-English speakers. There's a lot going on. So we wanted to make sure that within Diane and I, we had clear roles established so that, let's say, for example, I was running the technology and she was the one calling the participants at each webinar time. There will also need to be time for staff to learn or train on how to best utilize the different platforms. In our case, it was GoToWebinar, and it took a little bit of time for us to get acclimated with the system in order to best help those who are using it. We also involved the interpreter in helping plan the logistics. The interpreter was really useful in offering some cultural insights for how interpretation should run smoothly, and this was really crucial in the success of the program. We also realized quickly that we as staff need to be flexible and creative. Things will most likely come up and we need to be flexible and kind of think on the fly when those things inadvertently come up. And for webinars, we practice within ourselves and with our speakers. So Diane and I were the people that were running this, and we would host practice sessions for ourselves, and then we would invite our guest speaker, content expert, a day or two before the webinar, and they were able to get acclimated with the program as well. Lastly, we debriefed after sessions as program staff. Sometimes things went really well, and sometimes there were some technical glitches, but it was so helpful to be able to work with someone else to help troubleshoot those issues when they came up.
And our advice about budget. As you notice, this is not a small budget item. So to offer translation and interpretation in family trainings, the agency really needs to be committed to health equity, investing in community outreach efforts, and go after those grants that can support this kind of investment. But remember, again, some of the translation of materials is a one-time cost.
And lastly, for next time, for the Transition to Adulthood webinar series, something that we would love to do for future trainings is to make simultaneous interpretation the standard practice. We can't just assume that all of our participants, especially if we're reaching families, are going to be English speaking. So making sure that we, one, know our community, and then we're able to offer those services when we can. Another thing is that we'd love to involve the community in all stages of development. Hindsight 2020, we'd love to have the community involved with the planning, with the topics, picking the speakers, that sort of thing. And that's something that we would love to do in the future. And we'd also love to explore more user-friendly platforms. We know, like Diane mentioned before, we noticed that a lot of our community was really comfortable using Zoom. They really liked the ease and accessibility of just sending out a link and being able to join from whatever device that they had, because a lot of them didn't have access to a laptop. So exploring that and making it as easy as possible on both ends is something that we hope to do in the future.
For IFLTI, we too want to collaborate with community members on the overall design for those who are invited to participate with us. We don't want to assume that our design that we've used with English speakers and Western European cultures necessarily works for other cultures. We want to continue to cultivate relationships to secure Spanish-speaking mentors. That will be really invaluable. And of course, we can reuse those translated documents to amortize our investment this year. If I could do one more thing differently, I would add an extra staff person just to manage the tech while we're in our sessions, because as Alejandra said, there's a lot of moving parts. We love to network and learn from others. Thank you for attending this bonus content session for Family Voices Conference. Please reach out if you have, if you'd like more information, or if you'd like to share your experiences from diving into offering family training with interpretation and translation.